get the responses at a later stage. But thank you very much to all of you. And I do understand that this must have been a little bit long and intensive, but it won't happen like this all the time. We will always make sure we give you fresh information. At this point, we want to thank all our scientists and thank all the researchers for the exciting information that they've brought to the fore. And we're going to move on from there. Thank you. Hand over to Dr. Manzi. Please take your questions. Thank you.
Thank you very much, Minister. Now, I did indicate, Minister, to the broadcasters that we would really try to wrap by 9 o'clock. So I think we have 20 minutes to be able to ask questions, and we'll prioritize the media now. And so the first question is for the Honorable Minister from Sophie Mokoena. The Minister spoke about cutting-edge research capabilities as part of the task team that was appointed by President Ramaphosa during his tenure as chair of the AU. What is the continent doing to build vaccine manufacturing capacity? The COVID-19 has demonstrated that the global south can't always depend on the global north. The next question comes from Christian Duplessis from Network 24. His first question is, are we still going to use the AstraZeneca vaccine on healthcare workers considering the new data? And the second question is, should we not rather wait for adapted vaccines for the variants to become available? So either Professor Nadi or Professor Gray can take that one. From Nadia Honeyball, have you started or will you be starting soon with trials to see how effective the AstraZeneca vaccine is against severe cases of COVID-19 caused by the new SA variant? And she goes on to ask, if the vaccine is used now to vaccinate health workers, will you be vaccinating those workers again when more effective vaccines are secured? And I think there's quite a number of questions that have actually come through. And so I might as well just wrap them into one question where there are participants and members of the media asking if, in fact, it will be possible to give a different vaccine after you have given the AstraZeneca vaccine. And I think even on the next level then would be to answer, is it possible to use two different vaccines as a regimen together? The next question from Christian Duplessis again. What does the new data mean for the spread of the virus and achieving herd immunity? Professor Gray, I think earlier we did have a discussion about this. I think it's an important question. And then Nathan Geffen from Ground Up has asked, the Daily Maverick reported today that the AstraZeneca vaccines are expiring in April. Firstly, they want to know if this is true, and if it is correct, isn't it an unusually short expiry period for vaccines just received? And the third question is, if the AZ vaccine is still going to be rolled out, is it possible to use all the doses before expiry? And if not, is it still feasible to continue administering the second doses of the vaccines after the expiry date? And perhaps Dr. Anban Pillay may also weigh in on this question. I think, let me ask the last question from this lot. Again, Sophie Mokoena, vaccine nationalism is a big challenge. South Africa participated in the Johnson & Johnson trials. Will the vaccine be available to South Africa? And how are you going to deal with mutation of this virus in future? I will hold it there, and I think if we can start with the Honourable Minister.
Thank you very much. Let me make the responses brief. There is a huge discussion in relation to the creation of a manufacturing capacity in the continent. It's been raised by President Ramaphosa. It's been raised by a number of other heads of state. So there is a focus on that. In the interministerial committee that the president has appointed, there is a stream, work stream that is being led by Minister for Higher Education, Science and Technology and Innovation to look into that area of capacity of manufacturing in South Africa. There's already been a number of countries that have been conducted to discuss this particular issue. So it's certainly firmly on the table. Secondly, which vaccines will be used as we move on as of next week? I had answered the question actually. I have indicated that from next week, for the next 4 weeks, we expect that there will be J&J vaccines, there will be Pfizer vaccines. So what will be available to the health workers will be those vaccines. And I have indicated that the AstraZeneca vaccine will remain with us as long up until the the scientists give us a clear indication as to what we need to do, how we need to utilize it, and so on. That team has been assigned by myself to look into that aspect. They must also look into the issues of expiry. What should we do and how quickly can we deal with it? And also all of those questions once the team has looked into all of that. So there should be no wastage of any. We will get the answers as soon as the team has done other questions. Thank you.
So Lwazi, I can answer the question about what some of the things that from the minister. Just to say that we know someone asked, should we wait? So I want to reiterate that the J&J 826 vaccine protects against severe disease and hospitalization and death with the current variant. And so we have data from South Africa to show that we can use this vaccine to protect against death and hospitalization. And we are looking at further data about how this vaccine impacts on mild disease. So this is a vaccine that is a silver bullet. Yes, it won't protect against the sniffles, but it'll protect against death and hospitalization. And so, as the minister has said, this is one of the vaccines that we will roll out and we will evaluate, and we will evaluate in the field. And the first instance is to evaluate this and roll it out into healthcare workers. So I think we can't wait. We have data, local data now, and so it would be not good to wait for future vaccines. We have to start with the data that we have, and we have good data from the Ad26 J&J vaccine.
Thank you very much, Professor Gray. I just want to check if Prof. Madi would like to weigh in on any of these things.
So thank you, Lwazi. So I think there are two issues that I would like to pick up on. The first issue relates to interchangeability of vaccines. And those sort of studies are already underway in the United Kingdom, where some individuals that received the AstraZeneca vaccine will probably be receiving the Pfizer vaccine as a second dose. And probably within a space of the next 6 weeks or so, we should get some data with regard to the interchangeability of vaccines. And it might well be that in South Africa, that we also explore the interchangeability of vaccines, including possibly the J&J and AstraZeneca vaccine. The other important issue, which I think I would like to bring to the fore, is that it's very likely South Africa, unfortunately, will experience another resurgence probably in 3-4 months when we head into the winter period. And the question that we need to ask ourselves, in the context of knowing that the COVID-19 vaccines, both AstraZeneca as well as the J&J vaccine, are safe, foremost that they are safe. And even though there are question marks in terms of the effectiveness of the AstraZeneca vaccine against severe disease, do we want to take the risk of not vaccinating high-risk groups now, knowing that we're not going to cause harm, but that they might be protected against severe disease? So I think it's an important question that we need to address. And I think it somewhat would be reckless for us to decide just to discard of the 1 million doses of AstraZeneca vaccine that is available, with a biological probability that those vaccines might still be useful in terms of protecting against severe disease. So we might want to reframe our target group for vaccination in the next few weeks, few months, but it really needs to be centered around the prevention of severe disease and death from what will likely be a resurgence sometime soon.
Thank you very much, Professor Madi, for those very important points. I just want to check if Prof. Slim would like to say anything. Prof. Abdul Karim?
Yes, thank you very much. I think many of the points are covered. I'll just add to Professor Madi's important point, is that as we see multiple vaccines come out into the field, we're likely to see different responses. And the UK study that's looking at a mix and match of various vaccines will give us quite important clues. But given that we already are vaccinating people with past immunity, so in other words, those who've had existing immunity, I think that's a good signal, because those individuals, when given a single dose, for example, of an mRNA vaccine, have a massive boosting response. So I think it bodes well, but we need the actual empiric evidence to just assess the safety of giving the 2 doses and then the immunogenicity. And those are not clinical long-term studies. They can be done quite quickly and within a short period of time to answer that question. That if somebody took this vaccine, it didn't work, can they take another vaccine? Is it safe? And those answers are coming pretty quickly. And they should, I'm pretty optimistic that it'll be a positive response.
Thank you very much, Prof. Abdul Karim. Professor Shu?
No, thanks. Well, I don't think I can really add very much. I think everything has been said. Thank you.
Okay, thank you, Professor Shu. Now, if I may ask Dr. Anban Pillay, just if Dr. Pillay, if you could just answer the question about the expiry date, if you wouldn't mind. Thank you.
Thank you. Thanks for the question. Good evening, everyone. Look, the expiry date on the vaccines ordinarily are 6 months. These vaccines just have a 6-month expiry date. Unfortunately, these vaccines came through with an expiry date in April, which we only identified upon arrival. So we've engaged Serum Institute for an extension on the date, if that's possible, or an exchange of the stock so that we can have vaccines with a longer expiry. So we're just waiting for their response around that. Thank you.
Thank you very much, Dr. Pillay. I think I'm going to move to the next set of questions, and I think they may need to be the last set. So I will try and pick some questions that are sort of commonly asked questions across the board. So I have a question. I think if Minister can maybe tackle this one from Tamar Khan, who basically asks if we can give back the doses to the Serum Institute of India. And then we also have a question from Nadia Hannibal, and this will also be for the Minister. Will this new information about the efficacy of the AstraZeneca vaccine affect government's approach to lowering lockdown levels? That is, will government err on the side of caution with regulations? And then I think, Professor Gray, there is a doctor here who's asked, in terms of the vaccine rollout being used in a sort of trial or study format, are healthcare workers not being used as guinea pigs? Would you please respond to that? So may I ask the Honourable Minister to come through? Minister, we were struggling to hear the Minister earlier. I hope the connection is better.
Okay, you will indicate if there's any problem. I couldn't detect it from my side. Actually, I picked up that question from the platform about people being used as guinea pigs. Actually not. The truth of the matter is that the J&J vaccine has been proven to be fairly effective, as you will have seen from the proven so, and it's actually being used in other countries already. So we're saying that in the next few weeks, those are going to be the ones that we'll start on with. And in the process, we are actually doing an extra step, which is the implementation study. It's not the same as the original study where you give some people placebo and then you give them the vaccine. Here, everyone is now being vaccinated. All we're asking is, having vaccinated them, let's just keep a monitor what happens as we move on. It is not because we don't know what the efficacy was, which was already been proven. It is not because we have got a question about the safety. It's a question of saying now, we are now implementing what does it do? What do we need to change in the future in the way we go about it? But Professor Gray can go into that. But it's certainly not being guinea pigs. Once you get a vaccine, you are vaccinated. It's not like we're trying, it's not a trial and error. Once you get vaccinated, you've got the vaccine. And therefore, it starts the work of creating immunogenicity. And that we will continue with the same vaccines later, even if we have stopped this issue, the implementation study. We'll still continue with the same vaccine. So there's no one who's a guinea pig. It's actually an additional way. And that Professor Abdul Karim said, smart way of implementing. So it's implementation but in addition, we have also to do a study, and we've done that because we are seeing that there are interesting findings to get. Then, in fact, one of the other people, this one came from Dr. Kumete, but there's someone else there who I think his name is Mubaiwa, who was saying this is an agile, sustainable vaccination strategy. That's what it is, actually. What we have done, we've basically pulled everything that we've got, which is to our advantage, and we're pulling it together so that as we move on, we're able to vaccinate as we check also what else needs to be done as we go on with the implementation. We're not actually trying to find that. The question is now, it's now in reality as we go about this issue. And Dr. Ngiti then made a comment that SAPRA, the ball is in your court. True, it's in SAPRA's court, but in fact we have been discussing, and SAPRA has actually risen to the fore, because on the AstraZeneca they've actually issued that, and then they is in a position to also respond without compromising the quality of the work that they have to do. So from that point, we're dealing with it. So whilst it is an implementation, we also will be doing a study on it up to a certain number of people who are vaccinated. After that, we will just continue, because the vaccination process will be continuing. But the
I think we've lost the Minister again. Minister, we are once again struggling to get through to you. So let's ask Professor Gray to take over at this point.
So I mean, I'm happy to say that this is no experiment and this is no guinea pig. A single shot of the AR26 vaccine will stop hospitalization and death. And we intend to...
We'll need a certain number of people.
Well, apologies for that. I think Minister just has a signal problem. Please go ahead, Professor Gray.
Okay. So thank you. So I agree with the Minister in that this is healthcare workers are not guinea pigs, and this is not an experiment. We know that we know from our study that the AR26 vaccine starts from day 14 and 28 days after vaccination will protect against hospitalization and severe disease and death. And so we want to protect our healthcare workers.